Hello, this is Dr. Do again. This video is on alphabetic list of problems on letter P. Today I'm going to talk about the parathyroid diseases. Actually, I think I have talked about mention this parathyroid when I talk about the hypocalcemia. But since the calcium is regulated by many organs or many hormones or vitamins, not just the parathyroid, so I probably did not focus on parathyroid. Today I'm just going to talk about the parathyroid, start from the mechanism of this hormone and also the calcium, the nature, the characteristic of the calcium level in the blood. First of all, let me just bring up the emergency situation associated with this parathyroid abnormality or diseases. Usually this parathyroid disease is subtle. Actually, many of us probably carry this with us, just unknown. However, if in some people this parathyroid disease causes abnormal calcium, either too high or too low, since the calcium has a narrow window for the normal range, so either too much or too less will cause this arrhythmia, particularly for those serious arrhythmia. Could be life-threatening, for example, the bradycardia, or the irregularity or too fast cause this kind of life-threatening condition, syncope, chest discomfort. So if that's the case, see your emergency right away. But usually it's not quite common if isolated parathyroid disease, unless there's some comorbidities, some other diseases together. For example, the kidney disease, then will really increase this parathyroid disease caused arrhythmia. So, and can you manage at home? Actually, you're not managing. You just like I mentioned, there are a lot of us probably. I'm not saying everybody, but it's quite not uncommon that undiagnosed parathyroid disease for everybody. The symptoms probably just too subtle to notice, and then we just carry this along. But I'm not calling that as manage at home. After you're diagnosed, you need to communicate with your physician regularly, either hyper or hypo, but has to be monitored or treated under the guidance of your medical professionals. So this is about the parathyroid diseases and either emergency situation or manage at home, which means minor. But let me talk about the parathyroid itself. First of all, where are these parathyroid located? We have 4 of them. As the name implied, it's next to the thyroid, means parathyroid. So it's on the back of the thyroid. 4 corners or middle corners. It's about soybean sized, yellowish, actually the same color almost. And also the function of this parathyroid hormone is really to increase the blood calcium through the mechanism, either mainly through the bone absorption, which means to take the calcium, absorb the calcium from the bone to the blood. So this really causes the bone losing the strength because of loss of calcium. So if too much of this parathyroid hormone is not only affect the blood calcium level, also it's not good for the bone because you lost the strength of the bone. The inorganic component, which are the major component of the bone strength. So anyway, and also parathyroid hormone can regulate vitamin D and also the kidney function to maintain the normal calcium homeostasis. So usually what are the causes for this hypoparathyroidism? Adenoma, actually, it's just a hyperreactive, hyperfunctional of this parathyroid gland as an adenoma, but a lot of time, as I said, is undiagnosed. So this is, in some people, probably this subtle symptoms of hypoparathyroidism caused hypocalcemia is not diagnosed, not cause any significant symptoms. the subtle symptoms of hypocalcemia is thirsty, feel thirsty all the time, and that's probably one of the most common presentations, but it's easy to be ignored. And the other causes for this, the other causes of this hypercalcemia, in addition to this hypoparathyroidism regulated, and also the other bone diseases, just regularly release the calcium to the blood, but it's not quite common. So this is about the parathyroid. And there's when we talk about the hormones, we usually talk about the hormone, and also some hormones might antagonist of this hormone, which is calcitonin, to decrease the blood calcium level. However, the calcitonin is not so significant in regulating the calcium level, but it can promote the bone to take the calcium from the blood to increase the bone strength. So this is about calcitonin is the hormone secreted by the thyroid. By the way, is by the C cell, as the name implied. It's not a follicular cells, it's parafollicular cells, which means it's not. It's in between the follicles, and this calcitonin, however, can use as the tumor marker for the thyroid. So that's about the antagonist hormone for this parathyroid. And talk about the hypoparathyroidism, and there's a situation of hypoparathyroidism, which means decrease the parathyroid function. In another word, then the calcium will be decreased in the body, and the serious or the most serious consequence for this decreased calcium in the blood is the arrhythmia. Both increase or decrease of calcium really can cause arrhythmia. And what are the causes for this hypoparathyroidism? It probably is iatrogenic, and it's not a good word, happy word for the physicians, but it happens. Particularly if those people had the thyroid cancer, radiation therapy might sometimes cause this parathyroid is affected, or surgical, when doing the thyroidectomy to remove thyroid adenoma, for example, accidentally take the parathyroid. Actually, it's not common now, but probably 2 or 3 decades ago, when people do not know much about this parathyroid, it happened. I saw those kind of cases. After the surgery, patient developed spasm of the muscle, and after the scan, or find that the parathyroid is gone. So, but nowadays it's not common because everybody know it, and also the thyroidectomy surgery is not like previously so radical, massive taking out of the thyroid. Usually right now probably that's in rare cases. But anyway, so the symptoms for this hypoparathyroidism cause the hypocalcemia is the spasm of the muscle and loss of muscle strength. And seriously, the worst situation is the arrhythmia, like I mentioned, bradycardia or syncope or chest discomfort. So this is about parathyroid diseases. It's like I said, it's quite common. However, it's underdiagnosed and under recognized disease because we probably a lot of people just carry it with them. But anyway, the symptom, like I said, is very subtle. If you feel thirsty all the time without a diagnosis of the diabetes, then probably seek the other causes, like I said, the calcium abnormality. And anyway, so I'm just stop here. This video is, I hope it just doesn't help, maybe, but trigger your interest to search more about this organ, about the calcium metabolism in the body, how to maintain the well-being for the bone and also for the heart. I'm going to stop here, and thank you for watching. I'll see you next time.